Hi, my name is Dr. Viraj. I'm the implant surgeon here at RUH Dental, and I look forward to helping you replace your missing tooth. Implants are currently seen as the most effective way to replace a missing tooth. And if we actually consider how an implant works, well, it's a two-part system. So the first part is actually the screw part. This replaces the root of your tooth, which is the bit that's buried under the gums. And then you have a crown part which gets inserted into the implant, and that in itself obviously replaces the crown part of your tooth. If we think about the implant as being two separate parts, which is the screw part, and that is the bit that holds the actual tooth part in the mouth, then the implant itself can last anywhere between 15 to 20 years. And the crown, I would usually say, would last anywhere between 5 to 10 years. So if you already had a tooth taken out, then you already may know what that experience was like. Most people that have implants done with us actually say that it's even easier than the day they had the tooth taken out. Then the rest of the procedures after the actual implant has been placed is relatively simple, straightforward. Actually, for most of it, we don't even need to give anesthetic thereafter. So in the short term, the recovery time, we would usually account for about 1 to 2 weeks, and thereafter you're pretty much back to the way you were pre-implant treatment. So implants, just like teeth, can suffer with gum disease. Therefore, if you already have gum disease, it's not the ideal situation to then go and place or give you implants. Ideally, we want to treat your gum disease first, and then after that, consider implant treatment. The implants start from around about £3,000. That is for the implant and the crown, but you have to remember that sometimes additional procedures may be needed during the treatment, and this can obviously impact the price of the treatment.